Hello, Assalamu alaikum. In this video, we will understand about the dementia. So, what is the dementia? Dementia is the impairment of memory. Remember that things. So, in this way, basically the loss of intellectual functioning, thinking, and the personality changes. On the other hand, the organic disease of brain it is, and it is the neurodegenerative part of the limbic system will progress the whole nervous system. The progress of the whole central nervous system basically is the brain. So in this video we will understand first the dementia type, and then we will understand about the pathophysiology. The dementia can be Alzheimer's disease, vascular dementia, frontotemporal dementia, and Lewy body. On the other hand, the other dementia also include. Let's understand about the Alzheimer's disease. The prevalence 70% and characterized by amyloid plaque and beta tangles formation. The symptom can be a impairment of memory, language, and the visuospatial skill will be decreased. Vascular dementia is the prevalence 20% characterized by disease or injury to the blood vessels. A lot of things involved for the vascular dementia leading to the brain symptom, impair motor skills and judgment. On the other hand, the frontotemporal dementia is the prevalence of 10% characterized the deterioration of frontal and temporal lobe of brain is involved. The symptom of the frontotemporal dementia include the personality changes with language. So in this way the language can be changed. Lewy body is the prevalence 5% characterized by Lewy body proteins deposits on nerve cell. The deposition of the protein in the nerve cell is the Lewy body protein. That protein will lead to cause complication in the nerves and damage the nerves. The symptom is the hallucination, sleep disorder, and the thinking decrease. The skill of the thinking. The other dementia is 5%. This dementia related to Parkinson's, Huntington's, HIV, Korsakoff syndrome. Let's understand about from this is the old person more than 65 year, and this basically is the limbic system are present in the brain. The limbic system is important for the control emotion, thinking, and the happiness, rage, etc. The thalamus and basal ganglia, and this is the hippocampus, important for the memory and navigation. So the major cause in the hippocampus, this dementia, and this is the part of Alzheimer's disease. And in this way, here is the Lewy body protein will be deposited in the neuron, in the soma site. On the other hand, the vascular dementia is the hypoxia due to the less oxygen providing. On the other hand, the vascular disease. So this is a synaptogenesis is important for the increase the memory, the memorization. This is the amyloid protein 42 amino acid is a part of Alzheimer's disease deposit the extracellularly, while the intracellularly the tangle formation of microtubule with tau protein. This tau protein will lead to unstable because the cytoskeleton will be damaged due to the ring formation, the tangle formation, and the damage of the neurons and decrease of the gray matter. Due to this neurodegeneration will lead to neurodegeneration in central nervous system to cause dementia. Let's understand about the synapse. This is the presynaptic neuron and postsynaptic neuron. In this way, the neurotransmitter like acetylcholine, whenever decline, in this way it will not bind properly. The postsynaptic will lead to not depolarization properly. And in this way, the synapse will be problem. Acetylcholine is the neurotransmitter, remember, which important for cognitive function, for memory, and it is important for the accumulation of the calcium, trigger more neurotransmitter, but acetylcholine esterase help to break it down. Result is lack of the neurotransmitter. So the acetylcholine esterase inhibitor is used for the dementia cure. Anyhow, let's understand about the causes and the risk factors. What is the causes and the risk factor? This is the person is 65-year-old or above. This causes in their nervous system, the brain, which that is the genetic mutation on several alleles and the epigenetic mutation. This is the cause. On the other hand, the family history. The family history is also involved because it is genetic. So in this way, the gene alleles are present in the offspring. On the other hand, the medication. Medication means our uses of the medication are smoking and alcohol, excessive drug. Age factor 65 year above, and the traumatic brain injury, a tumor formation, which that will lead to cause dementia. The metabolic problems and endocrine abnormality, nutrient deficiency, as well as the Down syndrome risk factor. Let's understand about the risk factor. No, the risk factor is the basically is the Down syndrome, but the risk factor is majorly importantly is the diabetes, cardiovascular hypertension, as well as depression. The diabetes and cardiovascular hypertension, which that will lead to vascular dementia, and the depression, the smoking, air pollution, head trauma, and sleep disturb. Head trauma, which that is important for the damage of the limbic system and the vitamin deficiency. Anyhow, let's understand about the symptom. The symptom of the dementia. It can be a two type. We can categorize this dementia into two types, like cognitive changes and psychological changes. The cognitive changes mean the remembering process and thinking everything and memory. On the other hand, the psychological changes, which we will discuss in this way, the memory loss, communication problem, visual and spatial difficulties, and the difficulties in problem solving, the problem solution, the solution will be difficult, difficulty in complex task. The psychological changes is the personality changes, depression, anxiety, and inappropriate behavior. Paranoia and agitation, as well as hallucination, is a part of the psychological changes. By this dementia, the impairment of memory will lead to cause many complications. Like we will understand in this way the major complication. The poor nutrition, which that will occur due to the stop eating, and the pneumonia can occur due to the dysphagia, and the food can enter into the respiratory tract. Difficulty in swallowing lead to enter food in lungs. Inability to perform self-care tasks, the personal safety changes. In this way, the dementia is more important and the vascular dementia is more common to understand. So the vascular dementia is due to the many causes. Like here is the basically first we will understand the stages for the progression. Number one stage is the pre-symptomatic. In this way, the laboratory test can identify, while the mild cognitive impairment is the physical test is number two, and the dementia is the memory loss will lead to physical diagnosis. Anyhow, let's understand about the vascular dementia. It is more common, so that is why due to the vascular changes and the vascular problems. Here is the heart, which that is the part of the center of the vascular circulatory system. The coronary disease involve pericarditis, myocarditis, varicose vein, as well as the thrombosis, aneurysm and hypertension as well as hypotension. This is the major causes, and in this way here is the brain, and the brain is important for the oxygen providing mechanism due to the blood vessel. So in this way, the less oxygen hypoxia will lead to neurodegeneration because the apoptosis of the cell for normal function of nerve is the oxygen. Prevention of the dementia, let's understand about that. So the keep mind active is the prevention of dementia. Be physically and socially active. On the other hand, the quit drug like smoking and get enough vitamins. Manage cardiovascular risk factors. That risk factor will cure through diet. Treat healthy conditions and maintain healthy diet. Get good quality sleeping and treat hearing problems. Make routine daily and get involved in family will lead to get happiness as well as the normal physiology of the body, psychologically and cognitive, and that will lead to prevent the dementia. So in this video we have discussed about the dementia, the type of dementia, their causes and risk factor, as well as symptom and complication and prevention. I hope you make sense about that. If you like my video, please make sure to subscribe, like and share. See you in the next video for this time. Bye.